The Australian Mental Healthcare Classification is a consumer-focused classification that mental health clinicians use to describe changes to the primary goal of care. It includes a number of variables, including the mental health phase of care. There are 4 mental health phases of care, which describe the primary goal of care for a consumer at a specific point in time. In this video, clinicians discuss how applying the mental health phase of care to everyday clinical settings can bring real benefits. What can the team do to build a shared understanding?
Look, we've made it part of our daily conversation. So in our morning meetings, formulation, conceptualisation, POC is always mentioned, it's always considered. We found it really helpful too in conceptualising where to next for our clients. So even in terms of what do we need to move them to the next phase of care, it's always a consideration that we would be discussing with the team. Look, it's an essential part of our MDT meetings. We use it for initial conceptualisation. We always ask the question, where is our client in terms of phase of care? If there's any disagreement, we can't quite nail that down, we always consult the definitions of phase of care to make sure we're all approaching the client from the same angle. We've found that it's a very useful process in our planning.
Can considering phase of care help you think differently?
There was a long-term consumer in our community setting sitting on one of the phases of care, and we just rolled it over. By having a conversation with a colleague about mental health phase of care and asking the consumer and their family about their goals, we looked at the situation differently. We re-examined the goals and thought about the implications of changing the mental health phase of care. We started to think differently about the sort of care we were providing for that consumer and more widely.
Can phase of care help with resource planning?
It helps us tremendously when we're figuring out where our resources need to go. So to be able to figure out how much pressure the staff are under and where we need to move staff to help alleviate that pressure. We use the phase of care to drive decisions in operations for the business. A great example of that was when COVID hit. We knew exactly who needed to be seen and how often.
Is there a link to clinical risk assessment?
We use it as a risk assessment tool, along with other evidence-based risk assessment tools, to look at where the consumer is up to in their journey to drive our clinical outcomes. Well, it can really help when the consumer is feeling stuck and when we are feeling stuck in the consumer's journey. It can provide validation for where we are, and it can also help to see where we're going and where the consumer is going.
Any other clinical benefits?
Monitoring phase of care and having ongoing discussions about a client's phase of care can be particularly useful clinically. It often helps us identify in a timely manner if a client is deteriorating.
Tell us about phase of care and improving processes.
Well, we actually created a template that allowed us to place the phase of care right at the beginning of it so that we can consider the phase of care when we're discussing the client. It made it actually easier for the clinicians to keep the phase of care in mind when they're going through the information about the client so that we have a greater understanding of where they are on their journey. As we get new staff on board, the ability to discuss the phase of care is making it easier for not only the clinicians that are already there, but to teach the new clinicians as they come in and the phase of care is newer for them. So the process itself is becoming a lot smoother.
Can phase of care improve clinical teamwork?
It's a multidisciplinary team, and it's meaning that people are thinking a little bit more about the phase of care. I think prior to me being on this working party, it was very much a tick box, and even I didn't think about it. I just ticked the box. I think, in fact, it's making people think about things, revisiting goals, and in fact, we've seen people start to move. More clinicians within the team are considering the phase of care. It's become more multidisciplinary. It's changing the way we practice by ensuring that we're aware of the goals of consumers, their families, and their carers. From my perspective, it's become more collaborative, rather than myself determining where people are at. So this really is more than codes and administration. The mental health phase of care has real clinical utility.
Can phase of care help improve your understanding of your service?
When we implemented the phase of care into journey boards, it did an excellent job of clarifying and giving a lot of transparency on where the demand within the service was. And it helped management in particular understand where particular clinicians were who may not have high numbers on their caseload, but the acuity was very high.
When we use mental health phase of care, it is vital to involve consumers, families, carers, and peer workers, and to incorporate their goals. There are 4 mental health phases of care. You can explore ways of using mental health phase of care with your own team using the resources linked to this video. There is an overview video. There are meeting guides and presentation resources, as well as consumer journey maps. All of these can help your team build familiarity and a shared understanding of the phase of care, and let you enjoy some of the benefits we've shared with you here.